Psychotropic medications. Some medications, such as antipsychotic medications, may take up to a few weeks to help with symptom relief. It's important to give the medicine a chance to work before stopping it. Anti-anxiety agents, benzodiazepines. Anti-anxiety agents or anxiolytics can treat different types of anxiety disorder, including social phobia related to public speaking. They can also treat sleep disorders, panic attacks, and stress. How they work. This class is known as benzodiazepines. They're recommended for short-term use. Benzos work by increasing GABA levels in the brain, which causes a relaxing or calming effect. They have serious side effects, including dependence and withdrawal. Side effects of benzodiazepines include dizziness, drowsiness, confusion, loss of balance, memory problems, low blood pressure, and slow breathing. Caution. These medications can be habit forming if used long term. They're not recommended for more than a few weeks. Antidepressants. SSRIs, SNRIs, MAOIs, and tricyclic antidepressants. SSRI antidepressants. SSRIs are mainly used to treat different types of depression. Among them are major depressive disorder and bipolar disorder. Depression is more than feeling sad for a few days. It's persistent symptoms that last for weeks at a time. You may also have physical symptoms like sleep issues, lack of appetite, and body aches. Side effects of SSRIs include dry mouth, nausea, vomiting, diarrhea, poor sleep, weight gain, and sexual disorders. Caution. Some SSRIs can cause elevated heart rate. Some can increase your risk for bleeding if you're also using blood-thinning medications such as nonsteroidal anti-inflammatory drugs like aspirin or warfarin. SNRI antidepressants. How they work. SNRIs help treat depression but work a bit differently than SSRIs. They increase both dopamine and norepinephrine in the brain to improve symptoms. SNRIs might work better in some people if SSRIs haven't brought improvement. Side effects of SNRIs include headache, dizziness, dry mouth, nausea, agitation, sleep problems, and appetite issues. Caution. These drugs can increase blood pressure and heart rate. Your liver function must be monitored while on these medications as well. MAOI antidepressants. These drugs are older and aren't used very often today. How they work. MAOIs improve symptoms of depression by increasing dopamine, norepinephrine, and serotonin levels in the brain. Side effects of MAOIs include nausea, vomiting, dizziness, diarrhea, dry mouth, and weight gain. Caution: MAOIs taken with certain foods that have the chemical tyramine can increase blood pressure to dangerous levels. Tyramine is found in many kinds of cheese, pickles, and some wines. Tricyclic antidepressants. These are one of the oldest classes of antidepressants still available on the market. They're reserved for use when newer medications haven't been effective. How they work. Tricyclics increase the amount of serotonin and norepinephrine in the brain to improve mood. Doctors also use tricyclics off-label to treat other conditions. Off-label use means a drug is used for a condition that doesn't have FDA approval for that condition. Off-label uses for tricyclics include panic disorder, migraine, chronic pain, and obsessive compulsive disorder. Side effects include dry mouth, dizziness, drowsiness, nausea, and weight gain. Caution: certain groups should avoid tricyclics. This includes people with glaucoma, enlarged prostate, thyroid issues, heart problems. These medications can raise your blood sugar. If you have diabetes, you may have to carefully monitor your sugar levels. Antipsychotics, typical and atypical. Atypical antipsychotics. These are the next generation of medications used to treat schizophrenia. How they work. These drugs work by blocking brain chemicals dopamine D2 and serotonin 5-HT2A receptor activity. Doctors also use atypical antipsychotics to treat symptoms of bipolar disorder, depression, and Tourette syndrome. Side effects. Atypical antipsychotics have some serious side effects. These include an increased risk of diabetes, high cholesterol levels, heart muscle related problems, involuntary movements including spasms, tremors, and stroke. Other side effects of atypical antipsychotics include dizziness, constipation, dry mouth, blurred vision, weight gain, and sleepiness. Caution: Abilify, Clozaril, and Seroquel have a black box warning for specific safety concerns. There's a risk of suicidal thoughts and behaviors in people under the age of 18 who take one of these medications. Mood stabilizers. Mood stabilizers. Doctors use these drugs to treat depression and other mood disorders like bipolar disorder. How they work. The exact way mood stabilizers work isn't well understood yet. Some researchers believe these medications calm specific areas of the brain that contribute to the mood changes of bipolar disorder and related conditions. Side effects of mood stabilizers include dizziness, nausea, vomiting, tiredness, and stomach problems. Caution: the kidneys remove lithium from the body, so kidney function and levels of lithium must be regularly checked. If you have poor kidney function, your doctor may need to adjust your dose. Stimulants. Stimulants. These drugs mainly treat attention deficit hyperactivity disorder. How they work. Stimulants increase dopamine and norepinephrine in the brain. The body can develop dependence if used long enough. Side effects of stimulants include problems with caution. Stimulants can increase heart rate and blood pressure. They may not be the best option if you have heart or blood pressure problems.